Hey you guys, welcome back to our channel, Marriage and Medicine. This week, since we are currently in a pandemic still, a year and a half, 2 years later,
unfortunately,
we wanted to talk about some ways that you can cope, some things that we do to kind of help get through this time, because it is a little unusual, especially if you are a new doctor right now, whether that's a new resident physician or a new attending. It can be a little challenging. So we're going to share some tips of what we've been doing to kind of help make it through during this time. Feel free to subscribe to our channel if you haven't already. And if you haven't and you want to, you can follow us on Instagram at Marriage in Medicine.
Yeah, so I'll just start off by just telling a little bit about what my experience has been. Again, I started the pandemic essentially as a third-year resident in emergency medicine, and I have now transitioned into an attending. And so I've just been as an attending for the past about month and a half at this point. And just from the beginning, it has just been chaotic, essentially, is kind of the best way to describe it. We are having periods where we are just seeing so many people essentially in the emergency department at one single time. And I think the main issue that a lot of places are having is they're just running out of space. If you don't know, especially from emergency medicine standpoint, when you run out of beds upstairs, everybody essentially holds in the emergency department. You are waiting for beds, and so they're a bed hold, and then you have a bunch of people in the waiting room, and it just keeps getting worse and worse and worse, and there's just nowhere to go. And so when that occurs, it just gets very stressful, mainly because you have all of the nurses trying to take care of all these different patients. And so it gets very difficult to handle patient care when it comes to that. And so you get these individuals who also just come in really sick, essentially, a lot of times. And sometimes there's just nowhere to put them. I mean, sometimes you're getting to the point where you have to take care of these really sick patients in the hallway, and that is not very good for patient care altogether. But in these situations, you just have to kind of do what you have to do, unfortunately. And when it comes to COVID, it's unfortunate now that we are seeing so many sick people that we are at this point, mainly because with the vaccine, things are made better, essentially. When you get it, you don't have as bad of an illness, essentially. And it's unfortunate that we're still seeing so much of the population that are coming in with a lot of difficulty breathing, essentially, and just...
I was going to say, and it's not to say that if you get the vaccine that, oh, I won't get COVID, because people seem to think if you get the vaccine, you won't get COVID. And if you get COVID, then the vaccine didn't do its job. The vaccine does not prevent you from getting COVID. It just prevents that in the case you do get it, it should have lesser effects on you to where you don't have these like severe like hospitalizations and all those things. Right. That's also not to say that that can't happen, because there have been rare cases where people do still unfortunately pass even with the vaccine. Mm-hmm. But when you look at how many people have passed that were vaccinated compared to how many people who have passed that are not vaccinated, it's a big difference.
For sure.
So I put that disclaimer out there.
And even looking at the numbers in terms of who is in the hospital for COVID infections and the number of those who are vaccinated versus unvaccinated, I mean, it's pretty dramatic. But what you can also do is just take a look at, I think a lot of hospitals now are kind of posting their data. If you look at the number of individuals who are in the hospital versus in the ICU as well, who are vaccinated versus unvaccinated, you will see that there is a large disproportionate amount who are unvaccinated. I would say maybe possibly 10% of the individuals who are in the hospital currently have been vaccinated, which, I mean, ultimately that's what the vaccine was made to do. It's to decrease the amount of people who are infected severely, requiring hospitalization altogether. And I think from that standpoint, the vaccine has done a good job. Again, of course, with this Delta variant, it is much more contagious, it seems, than the previous one. And so it's spreading much more rapidly. I feel like during this pandemic, during this wave of the pandemic, shall I say, I am seeing it probably much more often than I was at the peak of it, where I'm currently practicing. And I think, and there's a lot of people who aren't that sick with it, but they clearly have COVID. But you have other individuals who are coming in, again, oxygen saturation down into the 50s, unfortunately, and requiring a lot of significant assistance. And over time, that takes a toll on you as a provider. Burnout is a real thing, and there are a lot of healthcare workers who are currently experiencing that. And so when it comes to that, you have to find ways in which you can disconnect, essentially. And I'll let you kind of start with kind of how you've been coping during this.
Yeah, well, it's a lot easier for me to cope because I'm not in healthcare.
Right.
And so obviously I can detach myself from things very easily. I definitely try to limit social media time, or I guess I try to follow more so accounts or things that are more positive and uplifting and encouraging versus like focusing on the negative. I also don't really take in too much news, whether that's on social media or on TV or however you get your news. I just decide not to watch it altogether. But I try to just focus more on like our family. It's easier for me to do being that I'm a stay-at-home mom. But that's been a big help, is just focusing on our day-to-day life and our day-to-day routine. From like with him coming in, I also feel like it might be easier for me because I don't feel like for you that it's taken too hard of a toll on you, or at least not at this moment. Like for some spouses, it's hard for them to detach from it because when they see their spouse come home and they're like exhausted and burnt out, naturally like you want to help them and make things better, and so that can kind of like affect them. But being that it's not like that for you, I feel like that also in turn makes it easier for me too. But I do think that I try to do a good job of like when you get home, like try to disconnect from work. Like we try to focus more on his days off, going to do something as a family, or once Naya goes to bed, like let's just watch a movie and relax, or let's, play games, just anything to disconnect from work. I try to like make him not check emails as often, or don't bring your work phone when we go out to dinner or whatever. These are just all simple things that we do to try to keep a separation between work life and just regular life. And I feel like that's what's really been helping a lot. And then one other thing I will say is that since the pandemic started, we've also still been attending church, even though it's been online for most of the time. I've been trying to be really consistent with still watching services weekly on Facebook or wherever, just to have that, like, you need the encouragement from like day-to-day life. And like even Naya, we have her watch that. She looks forward she looks forward to like watching the worship part and all of that. And so I feel like that also, it helps just kind of like remind you and kind of keep you encouraged during this time.
And essentially whatever it is that you like to do, make sure that you carve out time to do that still. I think that's one of the main things. And also from the job standpoint, again, as an emergency medicine physician, you see so much that you have to essentially be able to disconnect from. You see a lot of bad things. You see a lot of death. You see a lot of bad sicknesses, different things of that nature. In general, like pre-COVID as well, you have to find a way to be able to disconnect yourself and unwind while you are outside of those walls. Because if not, burnout sets in even quicker from that standpoint. And so having outlets is something that you absolutely have to have. Having ways to disconnect, like you said, kind of turning off your work phone if you have one, that is very important to do. And you also want to make sure that you spend that time with family. Do whatever it is you can to really kind of not think about everything that's going on back at work. When you are away from work, just make sure that it's a time for relaxation and unwinding.
I would say also, even if you're not a spouse of someone that's in medicine, but let's just say you have like a family member that's in medicine, or friends, whoever, if you know someone that's in healthcare, I would recommend that you do check on them from time to time, because it is stressful, not just for doctors, for nurses, for techs, like everybody, techs, anyone that is in healthcare right now, more than likely is feeling a little bit stressed or starting to feel like a little burnout. So I would say to definitely check on those people that you know of that might be in healthcare, and just be nice to them. Like,
please,
if you have to go in, even if it's just for like a regular well checkup, or God forbid you have to go in for an emergency, just be nice to the people there. Like, they're all trying to do the best they can with what's going on right now. They're trying to They're trying to manage how to like see so many patients, and there's not much that they can do. So just be nice to whoever you encounter.
You have no idea what's going on behind those walls. Essentially, you have as a patient. Essentially, you have your vision, your mindset of I'm here for this. I need to get this done, and I have other things I need to do. I need to go home. That's just not how it goes, unfortunately, in these kind of situations. You have to be very patient with the current healthcare system. If you are to the point where you feel as though you feel bad, but you are not to the point where you really feel like you need to come to the hospital, try and see if you can wait and see your primary care doctor if you need to. But of course, if you feel like you have an emergency, definitely come in to be seen. But just go in with the expectation that you're going to be what's considered triage, as in the sickest person is going to come back first. And if you're not the sickest person, you're going to have to wait a little bit. And that's got to be okay from that standpoint. But just definitely bear with us in those times as patients. We are definitely doing the best that we can all together.
Yeah, just try to make your house, if you are a medical family, try to make your house just like your safe space or your retreat during this time, where it's your space where you can come as a family and just escape from the world and put all of life's pressures or issues outside of your four walls. And it's just a place where you guys can be, relax, have fun, and just kind of like recharge and prepare for the next day.
Exactly. It's not going to be like this forever. Things are going to go back to pre-COVID at some point. We're just waiting for that time. But in the meantime, definitely make sure that you take care of yourself, take care of each other. Lean on one another. You're not in this by yourself. If you are one of the healthcare professionals, everybody that is here working with you is going through it right along with you. If you need to reach out to somebody, you need to ask for some assistance, whatever it is, definitely reach out. Feel free to reach out to us. I'm more than willing to talk about whatever with you. But thank you guys for watching. We'll see y'all in the next video.